This is Dr. Blied, and in this video, I want to share with you an exciting new direction in mental health care. I found it interesting and just wanted to share it on my social media platform so that you are aware as well. It's called the Precision Psychiatry Roadmap. This initiative, which is being led by the ECNP, outlines how psychiatry can move beyond trial and error treatment toward care that is more accurate, more personalized, and more effective. Currently, psychiatric diagnoses are mostly based on symptoms and what individuals report about what they're experiencing and how they feel. Tools like the DSM, which is our diagnostic manual as psychologists and psychiatrists, and also the ICD, which is the International Diagnostic Coding Instrument, provides a common language that helps to guide care. However, these systems don't reflect the underlying biology of mental health conditions. As a result, treatments are often chosen through trial and error, and many individuals can spend months or even years trying to find what works best for them. I am a personal testament to how frustrating that can be to switch from medication to medication, trying to find something that works best for your symptoms without causing side effects that are undesirable or intolerable. Okay. So the Precision Psychiatry Roadmap aims to address just that. It brings psychiatry into the era of precision medicine by combining three types of information: symptoms, biology, and also behavior. This might include genetic or molecular testing, brain scans, blood markers, or even data from smartphones and wearable devices. And by integrating these tools, clinicians and researchers can then gain a better understanding of both the environmental factors behind mental health for an individual, but also the biological factors for these conditions. And this can lead to more targeted and effective care. Let me tell you so much more detail because the juice and they say the devil is in the detail, but I say the angel, all the juicy stuff, which is so fascinating. So the roadmap focuses on three main priorities. First is global alignment. Progress will depend on collaboration across country and fields, including clinicians and researchers and policymakers, regulators, patients, and also advocacy groups. Using shared definitions, methods, and tools will help to make sure that research findings are consistent and that advances benefit people in a wide range of communities and cultures. So we're done away with the medicine and the research that just focuses on middle-aged white males. Let that be something that is just in the past because that does not reflect the global majority. The second is reaching agreements on predictive measures. This means identifying and validating biomarkers. That is measurable biological indicators that can help classify individuals into subgroups and then predict which treatments are likely to help. Achieving this will require large multi-site studies. And, who's ever working on this, clue me in. I am down to help and support and have a very strong research background. But get back to the sentence. So multi-site studies, close coordination with also regulatory agencies to make sure that these tools are accurate, but also safe and ready for clinical use. The third prong to this approach is bringing it into everyday care. The goal is not to replace existing diagnostic manuals all at once, but to gradually build a more flexible framework. And over time, both biological and behavioral data can become integrated with current symptom-based inventories, allowing for diagnoses to become much more precise as our scientific understanding evolves. The roadmap also recognizes that mental health is shaped by more than biology alone. That's where we get the epigenetic data. So environmental and social factors such as stress and trauma, discrimination, socioeconomic factors, even pollution, all of these factors influence our brain health. This broader view is sometimes called the exposome, which refers to the full range of experiences and exposures that can affect a person's well-being. By studying biology and environment together, psychiatry can, and I believe will, move toward care that more accurately and fully reflects a person's reality. Now, this is a long-term effort. Experts estimate that it may take around 10 to 15 years for precision psychiatry to be fully integrated into everyday clinical care. However, progress is already underway. International collaborations, shared research platforms, and online knowledge hubs are being created to support this work today in real time. And some of these efforts may also inform upcoming updates to diagnostic manuals. So when we move from the DSM-5 text revision to the DSM-6, for example, which could begin to include biological information in the years ahead. Now, I always give what also to consider. Here's another consideration. There are some important challenges to address. Some of the tests and tools involved to enact this precision psychiatry can be quite costly. And it will be important as the researchers and clinicians are moving forward with this to ensure that all people in all communities have access to these advantages and advances. Equity must remain a central focus. Some clinicians have also expressed concerns about the possibility of losing the human element in psychiatric care. However, the roadmap emphasizes that precision psychiatry is designed to support and not replace the therapeutic relationship. The goal overall is to provide clinicians with better tools while also keeping human connection at the center of care. If this roadmap succeeds, psychiatry can move away from this one-size-fits-all model, which anyone who's practicing psychiatry knows that that model just does not fit, does not exist. Diagnoses will start to become much more precise. Treatments could be more closely matched to individual needs, reducing the need for these lengthy periods of trial and error. Diagnostic systems themselves could become living frameworks that evolve with new scientific knowledge. This is an ambitious vision, but it offers so much promise. The Precision Psychiatry Roadmap represents a global effort to create mental health care that is more personalized, more effective, and ultimately more responsive to the complexity of people's lives. So the ultimate goal is clear: deliver the right treatment to the right person at the right time. I am so on board and can't wait for this to actually come to fruition and full use for all people in all communities. Thanks so much for listening. Tap in, comment if there are questions that you have, or maybe if you're involved and you want to get me involved too. I'm so on board. Take care, and I'll see you next time.